Hi, Reggie Davis here, and today I'll be performing a skills video for vitals. First, I'm gonna grab my patient. Hey, how you doing, ma'am? I'm Reggie. I'll be your nurse today. May I have your name?
Chelsea Kendoy.
Chelsea Kendoy. And Miss Kendoy, would you mind verifying your date of birth for me, please?
June 5th, 92.
All right, thank you for that. Now, today I'm going to be performing a set of vitals on you. Are you okay with that?
Yes.
Okay. Would you mind come over here? I'll bring a chair for you closer. Would you mind going and taking a seat? And would you mind making sure that your feet are flat on the ground, not hanging? Okay. Now I'm going to go ahead and close the door or close the blinds for her privacy. Okay. I'm going to perform hand washing. All right. And today we're going to be using a stethoscope and a speedometer for the blood pressure. Alrighty, I have my watch as well. All right. So the first thing that we're going to be doing today, Chelsea, is we're going to be assessing your radial pulse. Okay. Now the radial pulse can be found on the thumb side, on the ulnar side. Once I find the pulse, the rate and rhythm is normal. Now that I have found it, I'm going to go ahead and assess. Alrighty. So I assessed the radial pulse for 30 seconds. And the count that I got was 40. So we multiply that by 2, and her pulse was 80, which is within a normal range of 60 to 100. Now, if it was an irregular rate or rhythm, then rather than 30 seconds, I would be counting for a full minute to get a proper reading. I'm going to go ahead and check that one more time, though, if you don't mind, okay? Alrighty. So I just checked Chelsea's respirations. I counted for 30 seconds on that as well. I got a count of 6. Multiply that by 2, that's 12, which is within the normal range of 12 to 20. Also, what I did was I had my hand on Chelsea's back. And the reason why I was doing that is because as I was assessing her respirations and her breathing rate, I also wanted to feel the depth of her breathing to just ensure that her chest wall is expanding correctly while breathing, and that was normal as well. Alrighty, Chelsea, so next what we're going to do is we're going to take your blood pressure, okay?
Okay.
Now, for the blood pressure, if you wouldn't mind, your feet are already on the ground. Okay, so that's good. Would you mind going and placing your arm on the countertop? Okay, is that comfortable for you?
Yes.
Okay. Now, Chelsea, what is your usual, do you take your blood pressure at home?
Only when I go to the doctor's office.
When you go to the doctor's office?
Yeah, I don't check at home.
Okay, and what's your usual blood pressure reading when you do go to the doctor's office?
120 over 70.
120 over 70? Okay, 120 over 70. All right. So what I just did was, it's important to place the arrows down where the brachial artery is. Now this is her left arm, so the arrow is properly in place. Also, it's important to put the cuff about an inch to 2 inches higher than where I'm going to be palpating with my stethoscope, just to ensure that the stethoscope doesn't touch the speedometer during the assessment, because it wouldn't be an accurate reading. Okay, so let me go ahead and assess where that. Okay, and again, you shared your normal blood pressure is about 120 over 70, right?
Yes.
Okay. So what I'm going to do is, since her normal blood pressure is 120 over 70, I'm going to put the systolic number as I'm pumping up the cuff to 160 to make sure that it's 30 above for her systolic. So now that it's there, I'm gonna make sure that I release the air nice and slowly. Okay, so her blood pressure reading was 130 over 90, which is, her diastolic is a little bit higher than usual, but it's still within normal range for her. Okay, I'm gonna take this off. There we go. Okay. Alrighty. So we're all set. I'm gonna go ahead and perform my hand washing, and I'll see you guys for next time. Bye-bye.